Welcome to my YouTube channel. Our today's topic for discussion is lower urinary tract infections. In today's discussion, we will learn treatment duration, antibiotics used, role of nitrofurantoin, use of amoxicillin, Trimethoprim, Pivmecillinam, recurrent urinary tract infections in women and causes of urinary tract infections. Treatment duration for urinary tract infection. For women 3 days, 7 days for 1. Pregnant women 2. Males 3. Catheter-associated. Antibiotics used in urinary tract infection 1. Trimethoprim 2. Nitrofurantoin 3. Pivmecillinam 4. Phosphomycin 5. Amoxicillin 6. Cephalexin. Nitrofurantoin treatment therapy. Dose for modified release 100 mg to times a day. Dose for standard release 50 mg for times a day. Adverse effects of nitrofurantoin 1. Acute pulmonary reactions 2. Peripheral neuropathy 3. Rash 4. Nausea. Counseling points: take with or just after food. Patient monitoring 1. Liver functioning tests 2. Pulmonary adverse drugs reactions with long-term use, renal impairment for therapy. Short course if estimated glomerular filtration rate is 30 to 40 for milliliters. Pregnancy considerations: not known to be harmful but avoid at term. Amoxicillin treatment therapy. Dose 500 mg 3 times a day. Adverse effects of drug 1. Nausea 2. Diarrhea 3. Antibiotic-associated colitis 4. Skin rash. Contraindications for therapy. True penicillin allergy. Drug interactions 1. Methotrexate. Reduced clearance 2. Allopurinol. Increased risk of rash. Pregnancy considerations for amoxicillin therapy not known to be harmful. Trimethoprim treatment therapy. Dosed 100 mg 2 times a day. Adverse effects of drug 1. Hyperkalemia 2. Agranulocytosis 3. Cholestatic jaundice. Drug interaction. Methotrexate. Increased risk of hematological adverse drug reactions. Patient monitoring: full blood count and urine and electrolyte test with long-term treatment. Contraindications for therapy: 1. Severe hepatic or severe renal impairment 2. Blood dicrasias. Pregnancy considerations in Trimethoprim 1. Avoid 2. Teratogenic risk first trimester. Pivmecillinam therapy. Dose for 100 mg for 1 dose, then 200 mg 3 times a day. Adverse effects of drug 1. Diarrhea 2. Vulvovaginal fungal infection. Drug interactions: 1. Methotrexate reduced clearance 2. Valproate. Increased risk of carnitine depletion. Patient monitoring: full blood count and urine electrolyte test with long-term treatment. Contraindications for therapy: 1. Carnitine deficiency 2. Gastrointestinal obstruction. Pregnancy considerations for therapy not known to be harmful. Recurrent urinary tract infection in women. In postmenopausal women: 1. Consideration for vaginal estrogen 2. Treatment to be reviewed annually. Antibiotic prophylaxis for urinary tract infection in women: 1. Single-dose prophylaxis when exposed to an identifiable trigger: Trimethoprim 200 mg single dose and nitrofurantoin 100 mg single dose. 2. Daily antibiotic prophylaxis: Trimethoprim 100 mg at night, nitrofurantoin 50 to 100 mg at night. Follow up within 3 to 6 months. Cause of urinary tract infections. Usually caused by bacteria. Most commonly identified causative pathogen is Escherichia coli. Other organisms can include 1. Staphylococcus saprophyticus 2. Proteus mirabilis, more common in males. 3. Klebsiella species.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.